So to show the meds we use for trigger points, we are using some lidocaine with epinephrine mixed with triamcinolone, which is a steroid. Those go in the same syringe and we inject those directly into the trigger point. And for our patient today, we're going to add some neurotoxin to help relax the muscles for 3 to 4 months. So we do those in sub-Q syringes and inject them along the trapezius. So we're going to mark the spots that are bothering her. And we kind of found them already. Kind of right here, right, Amanda? Yeah. This side is really what's bothering her. She's got a big one up here. Am I hitting it right here?
Not quite, but you're close.
Because you've kind of got your scapula here. And I wonder if it's coming, because this whole trap here is pretty tight. So I think if we go, do you have any pain up here?
That doesn't hurt.
But down here?
Yeah, that does.
How about here? This is softer.
That doesn't hurt.
Okay, it's all up here. How about your neck?
I wouldn't say it hurts.
Okay, so your tightest spot is here.
Yep. Yeah.
And you feel like you got a bunch right here. I think I'm gonna trigger point 2 spots along the trap and then we'll just put tox along both of them. What do you think?
Perfect.
Okay. So the trigger points themselves use a 23 gauge needle, so it's more like a injection you get for a vaccine, and we dry needle it a little bit.
Okay.
So I'm gonna get this really sore one first so that the numbing medicine gets going. So in this syringe we have the numbing medicine and the steroid, and I'm gonna feel for like the tightest spot, and if you need to lay back or need a break, you let me know. Okay. 1, 2, 3, into the spot. And you can tell you're in the spot because the needle jumps. And we just kind of break up that muscle spasm a little bit. And then I'm going to fan it out into that muscle to get the numbing medicine. And so the numbing medicine provides some immediate relief, and then the steroid kicks in and helps with inflammation, and then we'll put the toxin in to keep it soft, if that makes sense. How was that?
Wonderful.
Really?
Yeah. Yeah.
I love trigger points because they're local pain management, but they work so well. And you don't, like, you're a busy mama, you don't have time to be on a muscle relaxer.
Correct.
Okay, I'm gonna go down a little bit, down here where you're tight. And get some of that steroid down here. And we just kind of fan it out. There we go. It's already softer.
It's crazy.
Put your hand back there and feel it. You can feel it's already a little softer. It'll take time.
That's crazy.
So now I'm going to take some neurotoxin and just inject it along your trap. So we do like, I'm going to get it clean. So we do like 10-unit bursts of neurotoxin along the muscle. And you won't be able to tell the results of that for probably a week. But as the trigger point itself is wearing off, then you'll have less tension in this muscle. So we just find the trap And just do 10 units at a time. Supposedly there's people that do this to slim their shoulders. I usually do it just to help with muscle spasm, but I mean, to each their own.
Slim your shoulders.
I don't know. I imagine you would have to use a lot for that. And we're gonna do the other side just so you don't get, because sometimes if you don't do the other side, then you'll get like, this will bunch up in response to that being relaxed. You know what I mean? Yeah, this one is not nearly as bad. But I don't want it to get sore because you're using it because the other one is paralyzed a little bit or weaker. And that's all there is to it.
Super easy.
So how was that pain-wise?
0. Honestly.
And do you have any immediate relief? Do you feel like?
It doesn't feel as tight as it did before.
And that over the course of today will get better.
Awesome. That was easy.
And then in like a week we'll check in and see what you think.
Yay! Thank you.